I mean, I've seen articles about, doctors should get involved as doctors, with the electoral system and income inequality. But that's not my area. We have to stick with our expertise, I think, because policymakers, in my experience, don't welcome doctors going too far because we only should talk, I think, largely about where our expertise is. We can't dilute our focus so much. And I think it's an abuse of our moral authority to get too far upstream.
I do think if I'm gonna listen for something that I can find agreement with you on, it is that as it is now, it is not the area of expertise for doctors. But that is a problem. So
Uh-huh.
I actually think, and I actually spend my time as a psychiatrist teaching medical students and teaching residents how this is something they have to have expertise in. They have to become experts in policy because the current way that we are operating is not working. We are not actually helping our patients get better. We can treat every single patient that comes before us, and we will not make even the slightest dent. That will matter to that one person, and it's important for that one person and their family, but we will not make the slightest dent in the problem in this nation and in the crisis that everybody likes to talk about around mental health and mental health youth crisis and all of that. We won't even put a dent in that. And so I do think that it is not our expertise. And that is why it is important for doctors to learn about policies, for them to understand this information so that they can go to their lawmakers and advocate on behalf so that we can make these changes.